A patient lies on a couch for 50 minutes 3 times a week, speaking whatever comes to mind about dreams, childhood memories, and relationship conflicts. The analyst says almost nothing, interpreting occasionally, for years. This image of psychotherapy, which dominated the field for most of the 20th century, has been largely supplanted by shorter, more structured approaches. But the questions psychoanalysis asked about the role of the past, the unconscious, and the therapeutic relationship remain central to all dynamic therapies. Freud's classical psychoanalysis is a long-term, intensive treatment, typically multiple sessions per week for years, aimed at bringing unconscious conflicts into conscious awareness, where they can be worked through and resolved. The primary technique is free association. The patient speaks whatever comes to mind without censorship, under the assumption that associations reveal the underlying structure of the unconscious. Dream interpretation treats dreams as the royal road to the unconscious, with manifest content concealing latent content. Resistance, the patient's unconscious avoidance of threatening material, is interpreted as evidence of the conflict being approached. Transference is the unconscious process by which the patient displaces emotional attitudes, expectations, and patterns from significant early relationships onto the analyst. The patient does not simply have a relationship with the analyst. They also have an unconscious relationship with the analyst as a stand-in for early caregivers. Analyzing the transference relationship, identifying the patterns it reveals, and interpreting their origins in early experience, is considered the central therapeutic mechanism of psychoanalysis. Countertransference refers to the analyst's unconscious emotional reactions to the patient, which must be monitored and managed. Modern brief psychodynamic therapies adapt core psychoanalytic concepts to shorter, more focused treatments, typically 12 to 25 sessions rather than years. They focus on a specific interpersonal problem or pattern, actively address the therapeutic relationship, and use transference interpretations selectively. Extensive meta-analyses show that short-term psychodynamic therapy is effective for a range of conditions including depression, anxiety, somatoform disorders, and personality pathology. Effect sizes are comparable to other established treatments, and some studies show continuing gains after treatment ends, more so than for CBT, possibly because insight-driven change continues to develop. Carl Rogers' client-centered therapy, also called person-centered therapy, operates on the premise that humans have an innate drive toward growth and self-actualization, and that psychological distress arises when this growth is blocked by conditional regard, the experience of being accepted only when behaving in certain approved ways. The therapist's role is not to analyze, interpret, or instruct, but to provide three core conditions: unconditional positive regard, accepting the client completely, without judgment, accurate empathy, deeply understanding and reflecting the client's experience, and genuineness, being authentically present rather than playing a role. Gestalt therapy, developed by Fritz Perls, focuses on helping clients become fully aware of fragmented or disowned aspects of themselves in the present moment. The therapist uses exercises and experiments to make the client's patterns and avoidances immediately visible and tangible. The empty chair technique has the client speak to an imagined person in an adjacent chair, then switch seats and respond, externalizing internal dialogues. Gestalt therapy emphasizes the here and now experience rather than historical analysis, and the integration of thinking, feeling, and behavior that the client has split apart. Across different therapeutic modalities, the single variable most consistently associated with positive therapy outcomes is the quality of the therapeutic alliance, the collaborative relationship and emotional bond between therapist and client, combined with agreement on the goals and tasks of therapy. The alliance accounts for approximately 30% of outcome variance, substantially more than specific treatment techniques. This finding, robust across thousands of studies, suggests that the common factors shared by all therapies may be more important than the specific techniques that differentiate them. The dodo bird verdict, from Alice in Wonderland, where all contestants win and all deserve prizes, refers to the finding that when rigorous meta-analyses compare different bona fide psychotherapies, they typically show equivalent outcomes. CBT does not substantially outperform psychodynamic therapy, neither clearly outperforms humanistic approaches for most common conditions. This finding, while controversial among therapy brand advocates, is robust across dozens of meta-analyses. It suggests that common factors, therapeutic alliance, expectation of improvement, a credible rationale, and emotional engagement, drive most of the benefit, with specific techniques contributing less than their proponents claim. The largest group of practicing therapists today identify as eclectic or integrative, drawing techniques from multiple theoretical frameworks based on what the evidence suggests is most appropriate for the specific client, problem, and context. Technical eclecticism selects techniques from different therapies without adopting their theoretical frameworks. Theoretical integration attempts to synthesize the underlying theories into a coherent whole. Common factors approaches deliberately emphasize the therapeutic alliance and common therapeutic ingredients. The movement toward integrative practice reflects both the dodo bird evidence and the real-world complexity of clients who do not fit cleanly into any single treatment protocol. Psychoanalytic and humanistic therapies represent the two great alternatives to cognitive behavioral approaches, each grounded in different theories of human nature and psychological change. The empirical evidence suggests that all three families of therapy produce meaningful benefits through mechanisms that are partly specific and partly shared, and that the quality of the therapeutic relationship matters more than the specific techniques for most clients.